So today's been a really, really exciting day for Coln Ward at Cirencester. I had this idea just over a year ago to create something more patient friendly and more inviting for our day room, to meet with place assessment, to have a nice room for patients to go to. I approached the college just as a, can you help me? And luckily the tutor there, Will, we liaised over the last year. I gave them the brief of what I was looking for. I went up, I met the students with some of my colleagues. I then chose the designs from some of the students, and there were so many designs to choose from because the students were really, really excited to be part of such a project like this, that they've never been onto a hospital. They had such an opportunity to be so creative. So we chose three main of the designs, which was the dormouse, the sun and the water scene, the underwater scene, mainly because each part would give a different perspective for certain patients. So one was really calming, the dormouse was really intricate so people could really understand and look at it, and the underwater scene was really nice bright colours. So for our patients with dementia, it had really clear edges, it had clear precise visions and pictures to help with our dementia care as well. So over the time that the students have been here, I've been absolutely amazed with how grown up they are, how they have loved coming onto the ward, saying good morning to everybody. We've had patients going into the day room while they've been doing the work, and they've been chatting, engaging with the patients. They've been really good with health and safety and signing in and signing out, cleaning up behind themselves. They've really thought of every part of this project. Also, I think they've enjoyed being part of something that make such a difference to the patients on the ward. We've now got a space where the ward assistant can take patients that I've had people already going in there and they've automatically gone, wow. And that's the reaction I wanted to see. People going into a room and going, wow. And then they can look around and really look at all the different images. Really, really proud of the students. Really, really grateful for all of the people that have been involved. The tutor really listening to what we wanted. The League of Friends that have given us the money to actually buy the paint in the first place, and to my staff to actually supporting the students coming on the ward. So really, really excellent project, and maybe just the first step of more and more connections with the college, because I'm sure we can utilise them a little bit more and they can utilise us as well.
So I started here on Coln Ward around the same time as what the students came in to create the mural. Prior to them painting the wonderful paintings that they have, it was quite bland and plain and not very exciting. So now that it's finished, it looks absolutely wonderful, and it's definitely going to give an amazing space where the patients can come along and get some stimulation from it, and actually hopefully give them some excitement to participate in activities that I'm going to be doing with them. So for instance, this afternoon we'll be getting creative with glues and different items like sequins, feathers, to initiate that sensory process, and hopefully gives them some inspiration to get as much colour as possible down onto their card and papers, and we've even got some doilies. So it's all fun and games, and hopefully it works wonders for them.
It's absolutely amazing. The students have done such a good job. I've been in there many times before. It was a boring room, just plain walls, nice colours but plain. And now they've got these fantastic murals. The students have just used their imagination, let it run, and had such a lovely time. The patients, I think, will let their imagination run and have a good time as well. We were approached by Karen probably a year ago, saying would we support and pay for basically the paint and any expenses that they incurred. And we were delighted. That is just the sort of thing that we want to do for this hospital. It's good that the college have worked together with the hospital, and I've been in a couple of times and seen them sitting cross-legged on the floor, painting away, paint pots around them, and it's almost they're so engrossed they don't have time to talk to you, but they're so appreciative, I think, of being able to do it. And I think they realise how much benefit the patients are going to get from it.
We're first year graphic students from Cirencester College.
We've been really excited to work on the mural over the past few weeks at the hospital.
It's been nice to work with a league of friends.
And it was great to meet you people.
So it was something new, and a lot of times I think a lot of people found that they've never done something on such a big scale before. So then we all tried something new.
We also put things into like perspective, of not just school, it's like real world kind of stuff.
Almost like work experience.
Yeah.
So we all got the responsibilities and stuff to do things.
And it's been a great pleasure this lunchtime in Cirencester Hospital to have a fantastic unveiling of a mural that's been done in the day centre, which is a fantastic facility for our inpatients in terms of a room that they can move from their bed and their room into that day centre. And previously it was well painted, well looked after, but it was just one colour. Whereas now you go in there, it's absolutely full of murals that represent both under the sea, there's a dormouse, there's a setting sun, really fantastic artwork. So a massive thanks to those students at Cirencester College, massive thanks to the League of Friends at Cirencester Hospital, and a massive thanks to our colleagues in that Cirencester Hospital who actually came up with the idea to make a day room that was great into a day room that is fantastic. So thank you very much.